So the key concepts, as a more or less linked, is that there needs to be a very clear linkage in terms of impairment-specific limiting symptoms that are materially contributing to the functional impact, and that needs to be done through a differential functional analysis. What is causing functional limitations across each of the specific domains? And that also mandates a keen understanding of the medical picture as well. So we have to understand, as psychologists, for example, when we're dealing with a chronic pain condition and we're determining that this individual can't go back to work, and it really doesn't matter. We know that there might be some physical contributions, doesn't really matter. We can still go ahead and deem the individual unable to perform the essential job tasks. In this situation, we need to know the medical picture and the actual impairments, limitations arising from the medical diagnosis. Because without that, we can't then say, what's the gap between what's explained medically and physically versus the individual's overall presentation, and assuming that the gap represents the psychological, the cognitive, and the like. Okay? So overall, very tight interdisciplinary analysis is required. I would strongly discourage folks from, lawyers like to encourage people to do this. Many times lawyers like to sometimes create a virtual team, not really even a virtual team, but a virtual set of reports that aren't integrated as a team. Strongly discourage folks from taking on a referral where the lawyer's just asking you to do the psych or the neuropsych CAT assessment, the orthopedic CAT assessment, and the like. If they're only looking for an orthopedic opinion, for example, around in Chapter 3, what the ratings are, that might be different. I think it's probably easier medically to do that, but certainly on the brain impairment, the psychological side, where we're really required to look at a broader functional approach and therefore tease out other contributions, it's even more incumbent upon us to make sure that we work in a tightly interdisciplinary team.